Good afternoon, everybody, and welcome to Jocelyn. I'm in the process of changing the show name after a number of years from Chit Chatting with Jocelyn to just Jocelyn. So sorry for a little bit of confusion as we start to work on the new backdrop. But I have a friend that we haven't had here in a number of months. It might even be closer to 2 years because it's been so crazy and you know all the nutsy things that went on in this world. And so we have Miss Julie back, and she's going to be talking about, again, everything that's near and dear to me and my friends, and I don't care who you are, that you want to look your best. And there's nothing fake about it. There's nothing wrong with wanting to be the best that you can be. I personally am a believer in, you earn the wrinkles, but you don't have to own them. You have some sun damage. Yeah, you have sun damage. You can reverse that. You can make it better. You need to really take care of your skin. There's just so much stress in the world that also, it's not just about sun. It's not just about the weather. It's not about just having a stressful life. There's a lot of things that play into that. So we're going to talk today about the different choices we have, the little machines you can buy at the local store, but what really works on a professional level. And that's why I have Julie. Welcome to the show.
Thank you.
I'm so glad to have you.
I'm glad to be here. It's really cool.
Fabulous. So talk to us. So you're a medical esthetician. You also are a national trainer and educator. So you travel to different physicians' offices and you train the staff on how to use these absolutely phenomenal machines that can hydrate your skin, that can resurface your skin, that can tighten your skin. So talk to me about, you know, I have little things like this and I brought them. I've moved on, obviously, because I see you. But when you're ready to move on from Walgreens, when you're ready to move on from online, we come to you. So talk to us about basics of skincare and then where someone can get hold of you and what you can do for them.
Yeah. For me, skincare is always revolving. It's always revolving. There's always something, new device, new service, new procedure that's coming out all of the time. And of course, new products, which are great to obviously work at home on your home skincare. For me though, I mean, I like to try different things out, whether it's something I can buy online or if it's something that I have to buy at a wholesale, professional retailer or distributor. And I like to find out what the benefits are and if they fit into what my clientele, patients would need. Because in my business, I basically, my certain niche is definitely tightening the skin.
Okay.
I've always loved anti-aging and I've always loved acneic skin, but I do love to tighten the skin. And there are certain devices out that you can use at home, and there are certain devices that would work better in, if you want to really get to grips with skin tightening.
So if you're doing procedures that tighten the skin, it's advisable for people at home to continue, not just count on you that you're going to be the miracle worker and they don't have to do anything else. They need to be working with you, correct?
Well, skincare is a journey, no matter, and if somebody tells you that you can get, the results within one treatment, I'm sorry, that's not going to happen because we're aging on a daily basis. So skincare is a journey, whether you do it at home or whether you do it with a professional person, whether it's a medical facility or whether it's a spa or whatever. And that can be baby steps for people who haven't had any kind of deep treatment at all, or it can go straight in there, depending what the client, and if there's a little trauma to the skin, depending if there's downtime, which means that there might be a little peeling or scarring, well, not scarring, but some kind of like tissue change color.
Correct.
So it all depends on what the client is available to have, their time scale, obviously whatever is in their budget, and what are they looking to achieve? Because you know, if they're looking to achieve something that is not available at my facility, I'll recommend them to go to a doctor or a plastic surgeon.
Oh, wow. So with plastic surgery being the I don't want to say the ultimate goal, but that would be an extreme, or I know what the word I'm looking for, but so
It's an extreme change, an extreme change.
An extreme change.
Yeah.
Okay, that's the word I'm looking for. And it's also very expensive, so many people need to figure out other options. And as you said, what is available to them, what is affordable to them for what they're looking to achieve. And it's not a one-time
Fix.
see you in 6 months, see you in a year. It's, as far as I'm understanding, correct me if I'm wrong, but it's at least once a month, every month,
Depending
to
on the
keep
treatment.
up with it.
Yeah,
And
yeah,
that's what I was going to ask you. And then based on, so it's not just something once and see you later. It's a program and a regiment that you need to follow.
Yeah.
And you can depending on what your client wants, you can tailor a program and treatments to them.
Exactly.
Is that correct?
That's totally correct. The skin and the fascia are the largest organs that we have in our body. So to change them, sometimes we have to resubmit, restructure. And of course, sometimes we restructure the muscle as well, because that obviously with age and gravity, everything is pulled down. So we need to restructure. And of course, we are always trying to induce more collagen into the skin. And that can be done. That can be done with treatments.
There's many schools of thought on collagen. And some people say that you can't just drink it or eat it and you're done. Or you can creams you can put on your face and there's collagen in that. Is any of that true? Is some of it true? Or again, is that something you need to do on a regimented basis?
It depends on the quality of the collagen.
Okay.
So there's so many collagen products out there. There are if we're talking about ingesting, you're talking about powders or perhaps liquid. And my clients, and myself included, have had better results with a liquid formula of collagen rather than a powder. I've been taking powder for years now, and I stepped over to liquid collagen about a year ago and got some great results. Not just on the skin and the hair end, but also on joints, because collagen obviously protects around the joints. So when you're talking about collagen being diffused or infused into the skin, again, it depends on the molecular structure, because if it's just going to sit on the skin, you're just paying for something that's just going to be rinsed off.
All right.
So yeah, there are collagen products out there that will make the skin look hydrated, make it look softer, but we really ought to be looking at inducing what we have, creating and restructuring the collagen within. And there are so many products that we can, or services that we can offer that helps it. Microneedling is one. When you are in a medical facility, the collagen induction can be used with plasma, blood plasma. It's usually
That's when they draw your blood and they spin it and then they put it back into
the
your...
the golden liquid. Now, depending on the patient, if they're have a great healthy lifestyle, that's great. But if their lifestyle or their health isn't at the optimum, then you're just putting that
You're just
back
putting the
into
same back
skin.
in, right?
Yeah. So there's other products that can go into the skin, such as stem cell. There are also exosomes now, which are a higher grade of a stem cell product.
Oh, wow.
So these are all coming from Europe, and just we've been using exosomes and stem cells to help scar tissue, to help with burns. I know there's a lot of plastic surgeons out there that are using stem cells for more reconstruction, when they, cleft palates and lips and what have you. So it really just helps the skin tissue form and
regenerate
and heal. It's a big healing thing, yeah.
Wow. It's really come so far. So let's talk about, so you have, and you do ladies and gentlemen, so
Always,
men don't be shy.
No, I mean, the thing now, whatever you want to call it, I mean, I don't want to say a guy who looks after his skin is metrosexual. It's just that in this day and age, what with social media and of course everything out there, we are really educated to take care of ourselves because, you know, are the next generation going to be taking care of us? We don't know.
We don't.
So why not? And self-care is not just about, you know, eating healthy and exercising and keeping hydrated and sun protection. It's taking care of your skin. It's taking care of all your organs. So this is just a part of it.
And as you aptly said at the beginning, that your skin is the largest organ on your body, and that's the one that most people don't take care of.
Unfortunately, yes.
Correct.
Well, yeah.
Yeah.
You know, I see a lot of aged skin because of sun damage primarily. And of course, depending on what kind of lifestyle you have. So it's a big factor. You have to take into consideration what you eat, what you drink, you know.
And alcohol is not a friend to your skin. It's not a friend to your body at all.
To be on the safe side, I never tell people what to do.
Right.
You know, I'm here as an advisor. And alcohol is just, it's going to dehydrate you.
I was just going to,
you know?
well, that's where I was going with that. Thank you.
So hydration is what
Important.
causes lines.
Well, coffee
and
does the
wrinkles.
same thing too. Coffee
stimulates.
dehydrates you.
Yeah.
So those are things, if you're wanting to take care of your skin, you want moderation.
Of course, yeah, yeah. And, you know, people who smoke, drug use, you see that in the skin. And it's best to be totally honest with your skincare advisor as to what your lifestyle is. And then we can really, you know, collaborate the best treatment for you.
Oh, that's so just, I love it. So talk to us about some of the little implements that you brought, these instruments.
Okay, so I'll begin with this one. This one is a gentle microcurrent device. It's called NuFace. And what this is it just kind of plumps up the muscle again. You know, as we, like what I said before, when we age, our muscle just kind of droops a little bit. So when you go to the gym, you build up your muscle on your body. You can't do that on the face. Well, with a device like this is a great one for home use. And I do believe that they retail under $500. It's not, you know, cheap, but it's a great little tool that you can use daily, every other day, what have you. And it comes with a gel, which you have to have a conductor gel when you're using electrodes like this. And what you do is you just gently, just slowly bring up the muscle, and it regenerates the muscle.
When I used one of those, it tingles. It also makes some of the muscles twitch.
It does.
Which is the microcurrent.
Of course. And then sometimes if you have, I don't know if anybody has like metal, you know, like...
you get zapped.
Well,
vibrates.
If you have like any kind of braces or any metal fillings, which a lot of us don't have anymore, but you can get that little kind of tingle. And also it can start salivary glands. And it's so funny. You're not going to drool or dribble or anything, but it's going to start, it's like, what's happening here? And I always tell my clients. But microcurrent was actually introduced into the medical world for Bell's palsy. So that was to help with the muscle. I've treated people who've had Bell's palsy, and it has actually helped. But again, any kind of device, if anybody wants any advice on microcurrent, I would love to help them. But you've got to be careful when you're doing. Obviously, there's contraindications, which means that sometimes it's not best for everybody if they have medical issues or a medical history. You know, so, and of course, when you are going to a professional esthetician, doctor, they should know what kind of contraindications are with each and every device. But this is a great little home device. And, but again,
reminds me of a frog.
I know, it's got that froggy eyes. But like with any kind of home device, consistency. It's like going to the gym. You've got to be consistent and train those muscles accordingly.
All right.
Because if you're going to just do it and then stop, Your
Well, it's
muscles
like coming to you once a year.
Yeah. So you're not going to get. So if
Right,
you're going to
the
invest in
results.
something like that, use it. It's well worth it.
I
So
love it.
I like that. little home
Fabulous.
care. Yeah.
All right. And these other pens, I believe, are...
I'll go on the gentle one first.
Okay, go on the gentle one.
We all know about microneedling. Okay.
That's little needles that go into the skin to... what's the word I want
It
to...
perforates the skin.
Perforates the skin,
depending on how long the needles are. And of course, what's happening there is that we are usually introducing a serum, a stem cell, or plasma into
which we talked about before.
And
right.
that is collagen induction therapy,
Gotcha.
CIT. This one is called a Regenerate. There's a few on the market, but this is actually a nano pen. So instead of having metal or stainless steel needles, we actually use silicone needles. So it only penetrates the first layer of the skin, the epidermis. But there can be a real change in the skin. It can really, really help fine lines, not deep wrinkles, but light wrinkles. And it just helps rejuvenate the skin. And that can be done every 6 to 8 weeks. And it's a wonderful, gentle treatment.
Nice.
You get a little stingle, but it's nothing painful at all.
No downtime.
No downtime. There's there might be a little pinkness because of course,
it's warm,
well, it will be more blood circulatory, you know, just as you would like a massage.
Well, it's the body naturally, if it's irritated, it goes to it, all the blood all runs to it to aid. And we don't want to say that there's damage, but you know, if you scratched yourself, the blood runs there to take care of a scratch. So this is no different.
Exactly. So again, with the silicone little needles, we use stem cell. Well, I particularly use stem cells to generate either brightening or any kind of bacteria on the skin, either acneic or an anti-aging. So it would be helping to rehydrate the skin.
Nice. So there you go, ladies and gentlemen, Regenerist for the first layer of your skin for brightening.
And then I did bring my absolute godsend, and I love this. So I train plastic surgeons and doctors and estheticians and nurses around the country with this device. And this is called the Plasma Pen by Louise Walsh. And this is a plasma device. And what we use this for is serious skin tightening, as well as lesion removal, any kind of, we do a non-chemical plasma peel. Instead of using chemicals, we can actually resurface the skin and it will peel off within about 5 to 7 days. And it's great. The best results are people who have acne scarring, anything like that. It's absolutely fantastic. However, we will put a stainless steel probe on. And the nitrous oxide in here will create a organ, well, not an organ, but it's going to be a plasma energy, not plasma blood, because people always get those two mixed up. So this is a plasma energy pen. It does not touch the skin with the oxygen that's on the skin. It will actually create a spark. So when you see lightning in the sky, that spark, that's plasma energy. So
and that's in that pen.
And that's what we do.
Is that the one that makes the dots on your skin?
Exactly. Okay. So what happens is that we will dot around the wrinkles and stretch that wrinkle out, smoothing and tightening that area of the skin.
Wow. Well, in full disclosure, you all know that I was EMS 911, and I was burnt on a call with nitric acid and sulfuric acid, so I had really nasty burn. And it was painful. It was not so nice to look at. The skin was getting very rough and it was tightening. Yeah. But not in a good way. Yeah. wasn't the good kind of tightening. And that I came to you. That's one of the first big years ago. I remember you doing that, and it was quite the procedure, and it worked. It worked very well. Yeah. I mean, it helped with the burns.
Yeah, it's an intense. It's not for everybody. Anybody who has problems with heart or any kind of blood clotting, this is not something for them. So, or anybody who's got really intense autoimmune problems, such as lupus, this would not be for somebody. So, of course, you know, a client coming in who wants skin tightening, I would do a full consultation on them and choose the right device for them.
That person.
Because of whatever results they want to get. But I love, this is what I would advise when I'm training. I would definitely have them, you know, come in and they get numbed and tightened.
Right. So that's absolutely true. You do numb the skin. You put it's not something that you do. You brave through it, people.
You breathe through it.
It's not for the faint of heart. You breathe through it. But it's if that's something that you're looking for, I can personally attest that it was everything it was supposed to be.
Yeah, and sometimes, I mean, depending on where the area is that you're tightening, you can disguise, you can cover, you can camouflage, you know, so we have got things that will help. And if anybody is interested in skin tightening with a plasma device, I know a lot of places where you can have that done.
Oh, fabulous. So talk to us in the few minutes that we have left about products for your skin, because there's so much out there. You need to be careful. I'm sorry. It's your skin, the largest organ in your body. And you want to, again, have a consultation. You want to make sure you've got the proper product for what you want to achieve. And the latest thing, correct me if I don't know if it's true or not, but the latest thing out there is that you just don't slather moisturizer all over your face, cross your fingers and hope everything's going to be okay. Just as you don't buy this and do it once and expect that your face was supposed to be perfect. It's a process. It's something that you really need to figure out what's best for you. So where would you start?
Oh, skincare. Yes, skincare is overwhelming. People get overwhelmed because there's so much out there in regards. If somebody's coming to me and they've used soap and water their whole life with nothing else, I would put them on a 3 system, just gentle, nothing that's going to overwhelm them. I would start with a cleanser. I would use a probiotic cleanser that's going to calm the skin, depending on if it's a milk or a gel, because some people like a squeaky clean feel, especially those soap users, and particularly men. And then I would have them use a exfoliator, and that would be at least once a week, because if you're going to put a moisturizer or a treatment onto dead skin cells, you're going to waste your money, and you're not going to get hydration like you should. So my thing is, always use something that's gentle, not a scrub, nothing that's come from a shell or a kind of like a walnut shell or an apricot shell. Those scratch and cause cuperos, broken capillaries. Those are the tiny red lines that you get on. Those are more damaging. So something very gentle. I love enzymes. So fruit enzymes that come from pineapples and papayas. So papaya. So that's like the papain enzyme and the bromelain enzyme. Those are the best treatments. Very effective, yet very gentle. And for my clients who have very, very sensitive skin, that's my go-to. And that's what I would usually introduce my clients. And there's a few things on the market there. But again,
there's a lot of fillers and a lot of the ones over the counter. There's a lot of petroleum
and lanolin and mineral oils and even coconut oil, because they're cheap, you know, so you got to, and whatever the lifestyle of the patient client, whether they like to go organic or whether they like to go natural or however they want to go, there's something for everybody. But my love is obviously getting them on the right treatment without overwhelming, because my philosophy is less is more. Absolutely.
Well, I want to thank you for coming and talking to us all about this. And you can find Julie in Amherst, New Hampshire, and the name of your...
My name of my business is Natural Radiant Skin.
Natural Radiant Skin.
Yes, and I have an office in Amherst, New Hampshire, so yeah.
Fabulous. And if you don't live anywhere around, you can still reach out to Julie, and she'd be happy to point you in the right direction, recommend you to another expert that can work with you, because that's what we do. It's all about helping everybody.
Yeah, I had a young chap in California And then I had a one in Dubai, and
Oh,
they
yes.
just reach out on Instagram or Facebook, and they'll ask me a few questions. And yeah, I'm going to give them some advice. And yeah, it's great.
I love it.
It's my passion.
Well, thank you. And I think maybe next time we'll be brave, and maybe we'll start with a simple procedure, and I'll be brave, and we'll videotape it so people can see what it's all about.
I do have something exciting, because there is a new device to the USA that's coming out. There's other devices in the competition, but this one is going to be absolutely fantastic, because I've already seen the results, and I am one of 50 people in the USA. So why don't we do something with that new device?
It sounds good. All right, I will be the little guinea pig, and we'll see what happens, and you'll get to see it firsthand. Maybe we'll go live for that one.
Oh yeah.
Yeah, absolutely. Thank you so much. I love having you here.
You're welcome.
We will see you next time. Thank you for joining us, and I hope you have a fabulous rest of your day.